yes, I'm Kelly Cullum. I'm the Deputy Divisional Lead for the community nursing teams across Lincolnshire and the skin integrity services within the collaborative community care for Lincolnshire Community Health Services.
Hi, I'm Kay Traves. I'm the implementation lead for the TWC project for Lincolnshire Community Health Service.
Thank you. So the Transforming Wound Care Early implementation was focused in one of our 11 community nursing teams within Lincolnshire. The locality was Skegness, and this area was selected for the pilot for several reasons. One, because of the change in population size during summer, we go from 53,000 to 73,000. Often these patients have lower limb wounds that the team are requested to see within temporary accommodation and who aren't sort of permanent residents. And we were keen to understand the impact of this. Skegness in itself is one of the most deprived areas, certainly within Lincolnshire and across the country, and there's a higher proportion of older people within that area of Skegness. Obviously we get a lot of people sort of choose to retire to the area, and that impacts on care provision. There was also, we have good networks, and we're doing a pilot across the PCN for neighbourhood working, and it was considered that as part of the piece of work it would be helpful to have those neighbours and other organisations on board if we wanted to look at rolling the piece of work out further and to be involved in the planning stages if necessary. Our quality indicators within the Skegness team at the time, we had some concerns and some specific patient complaints regarding lower limb times, care and sort of healing rates, and so it was felt that this would be a good area for a focused piece of work on. And we also had a clinical lead who was situated in that area, who was really enthusiastic about driving this piece of work, and we knew that that would be sort of critical for success. I think the main aims were being able to find a baseline regarding our data. So we had very little information to say whether the patients were healing, whether they were deteriorating, the amount of time that these patients received from sort of very stretched nursing teams. It was also to improve patient care and patient outcomes in terms of the pressure care that patients within the Skegness area were receiving, and it was to improve staff well-being and job satisfaction so that they could actually see how they were impacting on patient care. And to do something innovative, we've struggled with staff shortages in the area, sort of high staff sickness, and we really wanted to demonstrate that as a small team we were able to still make service improvements even despite sort of staffing shortages and challenges within the team.
I think there was two challenges really. The collecting of the data had been a massive challenge for us. As Kelly's already mentioned, the baseline data we weren't able to collect that we needed, and luckily for us, because it was a smaller team, the caseload was smaller, so we were able to gather the data manually and work towards collecting it electronically. And also the staff morale within the team, and to get their engagement to develop the project with them, that was a challenge. But we did use alternative ways, and we spoke to them about engagement and how they wanted us to engage. think that would be the healing rates of the patients. As we've gone along, we've realised, yes, we had a small caseload. However, we had 11 patients